Hello everyone, I'm Dr. Advaith Sai Alampur, consultant cornea and refractive surgeon, Sai Eye Hospital, Secunderabad. Today's topic of discussion is myths and facts about Lasik. Lasik is a laser refractive surgery which is done to the eye to basically correct your vision, to get rid of your glasses or contact lenses. Lasik is also known as laser assisted in situ keratohemolysis. Now today we're going to be talking about few facts and myths about Lasik. Now there are certain myths that patients are always in a misconception regarding Lasik. For example, Lasik is painful. That is a myth. Now Lasik is basically a painless procedure. In Lasik what we do is we give anesthetic eye drops to numb the eye, so patient does not feel any pain or any discomfort during the procedure. And Lasik is an absolutely painless procedure. It takes about 3 to 5 minutes for each eye. Within 10 minutes the procedure is done and the patient can leave home immediately on the very same day. There are another myth that Lasik could be that a patient could go completely blind because of Lasik. Now Lasik is a procedure that is done to the front surface of the eye, which is basically the cornea. So patient going blind because of Lasik is extremely rare, where we don't see any patients going blind. There could be some side effects and complications, but patients going blind because of Lasik is something that is not there. And there's another myth that any candidate could be an ideal candidate for Lasik. No, not every candidate is ideal for a Lasik. Now anybody who walks into the outpatient department asking regarding Lasik, what we do is we do a safety test. Now this safety test is basically to measure the thickness of the cornea. Now cornea is the front transparent surface of the eye where we do the laser procedure. So because we're altering the shape of the cornea, we need to make sure that the cornea is thick enough for us to do a Lasik on this patient. So after doing the safety test, and when we know that the patient is eligible, where we know the thickness of the cornea is sufficient, only then the patient will be an ideal candidate for a laser. Another myth is Lasik can correct only nearsightedness, not farsightedness or astigmatism. No. Lasik is a procedure which can correct your short-sightedness, it can correct far-sightedness, and it can correct any astigmatism. It can correct from a low power to a very high power. So Lasik, because of the advancements of the Lasik, because right now we have customized treatments available for laser, where each treatment is customized for a different individual, the results are also extremely good. Few other myths like you don't ever need glasses after undergoing a Lasik. Now that is not completely true. Laser is something that we are correcting to get rid of your distance vision. So normally after the age of 40-45 years, everybody gets reading glasses. Now this is something that is age related problem, that like how you have graying of hair, we also get reading glasses after the age of 40. So whatever it is that is we are correcting is basically to get rid of your distance vision. So after the age of 40-45 years, you'll definitely get reading power, for which you'll have to wear reading glasses. Another myth of regarding Lasik: if you have a poor visual outcome, nothing can be done regarding that. Now Lasik, as I said, Lasik is one of the most successful procedures that is performed in your eye. Now another myth regarding Lasik: if you have a poor visual outcome, nothing can be done. Now Lasik is one of the most successful procedures that can be performed on your body, and it is one of the most commonly performed procedure in your body. So because of which the success rate also is extremely high. Now however, there are chances that there could be few complications or side effects. But because of the latest technologies and the equipment that is available, these can be corrected. So if any visual power is undercorrected or overcorrected, these are the treatments where, these are the patients where retreatments can be done and that can be corrected. So another myth is Lasik is new. So we don't really know about the long-term side effects and complications regarding Lasik. So patients are also under misconception that Lasik treatment is something that is new and we don't know about the long-term results of Lasik. That is not true. Lasik has been started from the year 1980s and it has become FDA approved from the year 1991. So for more than 3 decades, we've been doing laser refractive surgeries and the results have been extremely good and the success rate is more than 98%. So along with that, we do something called a safety test for all the patients. So only then we know if the patient is eligible or ideal for a Lasik or not. So these were the myths and facts regarding Lasik. Thank you.